feel like a safe community. We raise our keiki here, and they love the aina, they love the ocean. They're raised in Olelo, Hawaii. Just a really big sense of community here and safe.
For many, this is life on Kauai, and this is why Miley Kennedy and her husband Saber chose to live on the Garden Isle.
I think being a little bit more secluded and separated is a blessing, of course, because it's just a unique lifestyle here. Yeah.
But the seclusion that so many desire can also come with its drawbacks.
Healthcare-wise, lots of things are difficult.
The physician shortage that plagues the entire state is even more pronounced on neighbor islands like Kauai.
Personally, having a primary doctor, in the 12 years I've had 3 or 4, and sometimes it's really hard to even get a primary doctor.
It gets even tougher when urgent, unannounced medical issues strike.
This is about 5 years ago.
Saber unexpectedly started having chest pains. He was rushed to Wilcox Medical Center, the largest hospital in Kauai.
They decided to medevac him to Oahu. We didn't know if they were going to have to do open heart. We didn't know what it was that was going to happen on Oahu specifically.
Miley says the separation was worse. She stayed back with their 3 young children.
We were separated as a family. I couldn't go with him. I had to stay home with the kids. So that separation and not really having clear communication with him ongoing and not being able to be there for him was difficult.
Thankfully, everything turned out well. Saber didn't need open heart surgery and stayed on Oahu, where he was monitored for a couple of days. He's been back home ever since. But that terrifying episode had Miley reevaluating the health resources on her home island.
It is worrisome, especially as we get older. My husband's 51, his dad is 76. And things happen. We definitely experienced some scary things through COVID.
Addressing the healthcare shortage in Hawaii has long been the goal of the John A. Burns School of Medicine. In 2022, JABSOM, powered by a generous gift from Dr. Priscilla Chan and Mark Zuckerberg, launched the Kauaʻi Medical Training Track. Each year, 6 JABSOM students live, learn, and train on Kauai. Dylan Lawton is one of them. He was inspired to join the training track because of his ties to the island.
I was thinking about, how can I alleviate the burden of physician shortage, as it has really affected me and my own family, and it caused a lot of hardship for my grandparents and their extended family that live here.
Dylan is part of the first group, or cohort. KMTT students receive full-ride scholarships to JABSOM. In exchange, they complete about 40% of their medical school training on Kauai and are committed to practice on Kauai for 4 years after completing their specialty physician training called residency.
First and foremost, I hope to make an impact on that and try to relieve burden from.
During their time on Kauai, KMTT students will work at various clinics, including the Primary Care Clinic of Kauai, Ho'ola Lahui, Hawaii Health Systems Corporation's Waimea Clinic, Kauaʻi Medical Clinic Kapa'a, and of course, Wilcox Medical Center. Wilcox CEO Jen Chahanovich knows when it comes to the overall health of Kauai, investing in this training track now will pay huge dividends very soon.
I had all the students come in and we just sat and talked story. I got to know them. I wanted to know what they needed to really feel at home here. And so I am not the only one who did that. When they walk in the hallway, we're all excited to see them here. And what it means to Kauai is that the future of medical care will be secured by this Kauai Medical Track, the first, second, third, fourth, and fifth year students.
The time spent in clinics gives students an eyewitness perspective to what being a physician on Kauai entails. It helps familiarize them with the health systems and, more importantly, the people they'll serve.
And I think it's super crucial for us, to get integrated, face to face with community members. And socially, I think each one of us has found an outlet to do so.
The day-to-day life of a KMTT student may seem different from the majority of JABSOM students. They live in this house in Lihue and join lectures remotely. But Dylan sees more similarities than differences.
A lot of the times I would, stream the lectures virtually when I was on Oahu anyways, so the transition academically from JABSOM was really smooth, and I felt that the fact that we had our problem-based learning tutorials on island with Dr. Erica Noel at Wilcox Medical Center really helped to have that in-person interaction, with my fellow cohort members and also a pediatrician, an actual physician in the room who practices on Kauai, is very integrated into the community and knows the medical problems and issues of the population here. Really helped me personally to not only learn more about the unit, the topics that we had, but also the community and social aspects of medicine here as well.
Some classroom learning is done remotely. The clinical teaching is all in person, but some academic exams are done a little differently. When it came time for the mandatory year-end basic physical exam on a patient, KMTT students got creative.
We actually just practiced on each other, so it was nice that there were 6 of us and we paired up, so 3 pairs, and we would actually, practice a physical exam sequence. Dr. Hong, would fly in and teach us, and Dr. Erica Noel as well would help us to kind of translate what we've learned in the classroom to actually, implementing these vital, physical exam clinical skills during that time. So it was fun. Just, we were on different couches, pretending it was like an exam room, and we went through the whole sequence, getting advice from our preceptors.
The goal of KMTT is to immerse students in everything Kauai: the people, the places, the culture. That's because after graduating and completing residency, those in these cohorts are committed to practicing on Kauai for 4 years. The time spent on the Garden Isle has already made an impact on Dylan. Shadowing a cardiologist, he saw firsthand the need for geriatricians.
Being able to kind of cater my interest towards serving that population has helped me to shift my focus and say, hey, Kauai has so much need for this.
The relationship building extends beyond future physician and patient. The COVID-19 pandemic revealed just how entwined primary care providers need to be with the island's health department.
We rely on our primary care providers to report things to us, and then they can rely on us to take care of things like isolation and quarantine and preventing spread.
Officials have realized it's hard to do that when physicians aren't always committed to Kauai.
It's obviously harder to keep up relationships when you have kind of a revolving door of primary care providers. So allowing them to spend significant time here throughout the 4 years of medical school, I think will really ground them in the medical community here as well as in the resident community and make it much more likely that they will be long-term members of our healthcare providers.
Since the program is in its infancy, the KMTT students aren't doctors yet. But as they continue to weave themselves into the fabric of healthcare on Kauai, locals know JABSOM is doing what it can to ensure residents won't have to leave the island to get care.
It sounds like it's much needed. It sounds like very beneficial, not only for the younger generations, but supporting locals to stay here.
So my vision would be that the majority of people on this island, when they go to see a primary care provider, can see a primary care provider who has that same familiarity and embeddedness with the community.
10 to 15 years with a crystal ball, what I see is that we will have enough primary care physicians, pediatricians, specialists, that Hawaii community can receive all the care they need on Kauai.